Well, thank you, Chairman Alexander. As I have made clear, the burden of prescription drug costs is a huge problem. I hear about it from far too many families in my home state and across the country. So I am glad we're having this discussion today. It's something Democrats on this committee have wanted to do for a very long time, and I'm pleased that we are working on some additional hearings. I'm hopeful this work can lead to some real bipartisan progress. I want to express my appreciation in particular to Senator Franken, who's been underscoring the importance of hearing from actual patients about the struggle they face in affording medication they need. Our work on this committee is strongest when patients' and families' voices are part of this process, and I agree we should make sure that that happens as our discussion on this continues. I also want to note that today's hearing on a topic central to families' experience with our healthcare system takes place in the midst of a pivotal and deeply concerning moment for our healthcare system as a whole. My colleagues on the other side of the aisle appear to be dead set on jamming their version of Trump Care through the Senate in a matter of days. They have held no hearings, engaged in no public debate, and provided no information for people across the country to understand what this all-male Republican working group has in store for their health and financial security. For comparison, during the debate on the Affordable Care Act, we held 57 bipartisan meetings, hearings, roundtables, and walkthroughs on the text in this committee alone, and another 53 in the Finance Committee. There were 25 consecutive days of debate on the Senate floor. So, Mr. Chairman, I just have to say this morning, I can't say how strongly enough, how unacceptable this is, and I will be very loud and vocal about this and continue to push for hearings and open debate on the Senate version of the Trump Care bill. In fact, given this committee's long track record of bipartisan successes, I have to say I'm really surprised and disappointed that we're allowing this to happen. And I know you're part of the process that's going on in secret. I just have to tell you, people deserve public debate about the future of our healthcare system, especially since all Senate Republicans' promises to the contrary. It unfortunately sounds like this legislation is based on the very same principles as the disastrous House Trump Care bill, including higher costs for families, especially seniors and people with pre-existing conditions. Millions of people will be kicked off Medicaid. Insurance companies once again will be allowed to charge people more for basic health care like maternity care or mental health services, or, as we are talking about today, the expensive but essential prescription drugs they need, all to give a massive tax break to special interests in the health industry and hand President Trump a hollow political win. So let's be clear, as many of my Democratic colleagues have said, this isn't a health care bill. It is an attack on families and health and financial security. And what I really do hope is over the next several weeks, as Republicans hear from many people across the country who would be devastated by this bill, that they choose to change course. And I will say again, Democrats are ready, like we always have been, to work together on continuing to fix our healthcare system in ways that make our healthcare system more affordable while preserving quality of care and getting more people covered. But we cannot begin that conversation until Republicans reverse course and stop trying to take our healthcare system backwards with a reckless repeal effort and politically motivated sabotage that is creating damaging uncertainty in our markets and driving up our families' costs. So I sincerely hope that this effort is backed off, because there are urgent challenges like the one we are talking about today that really deserve our attention. Today's astronomically high prescription drug prices are an unsustainable burden on our healthcare system as a whole, and especially on the patients and families that we represent. I have heard from far too many families who are forced to choose between high-priced medication and paying the bills or putting food on the table, and that really is no choice at all. So as I've said before, it is well past time for this conversation and for progress on this issue. As we discuss the reality of the high prices too many of our constituents are paying for prescription drugs, I do think it's important to note that President Trump is wrong to point the finger at the FDA. Over 2/3 of new drugs are now launched in the United States, more than triple the rate in the early 1990s when the first user fee programs were enacted. The agency has reduced the backlog of generic applications to help get competitive, cheaper drugs to patients. And I'm pleased this committee took steps in the FDA Reauthorization Act to increase transparency and foster more competition in the generic market, thanks to the work of Senator McCaskill, Collins, and Franken. While we should always look for ways to get more safe, effective treatments to patients as quickly as possible, the FDA approval process is the wrong place to look if we really want to tackle high drug prices. I'm proud that a number of Democrats on this committee have put forward a number of ideas to get at the root of the problem, which is the high prices set by drug manufacturers. Democrats have introduced legislation, including bipartisan legislation, to demand more transparency from pharmaceutical companies about what is behind the soaring drug prices, allow Medicare to negotiate fair prices for prescription drugs, and to prevent manufacturers from engaging in price gouging and more. I'm grateful to all the members of this committee who've worked together and across the aisle to advance these policies, which would make a real difference to the patients and families we serve. Mr. Chairman, I'm glad to hear that today's conversation on the burden of prescription drug prices won't be the last on this committee, but there's a lot more we can and should do together to tackle this issue. And again, it is deeply disappointing that instead of working with Democrats to bring down the price of prescription drugs for families and the other challenges that so many people face in the healthcare system, my Republican colleagues are very focused on a partisan, political, and damaging effort to enact Trump Care within the next few weeks without any public scrutiny. I really hope that instead of working to jam Trump Care legislation through, according to an independent CBO analysis, is a direct threat to the lives and health and financial security of millions of people, that you all will reconsider, reverse course, and work with us on solving problems. And if you do, if you drop your efforts to sabotage the healthcare system and enact Trump Care, and if you are ready to tackle the challenges like bringing down the healthcare costs for families, we are at the table. We are ready to work, and we want to do that. Thank you very much, Chair.